You've probably already heard of Alzheimer's disease and of Parkinson's disease, probably even Tourette syndrome and Fragile X syndrome, but there is a rare neurological disorder that you might not have heard of. Christianson syndrome is a rare neurodevelopmental and neurodegenerative disease that affects between 1 in 16,000 to 1 in 100,000 people worldwide. It is mainly characterized by nonverbalism or lack of speech, epilepsy, ataxia meaning problems with balance and movement, intellectual disabilities, abnormal eye movements such as strabismus, hyperkinesis meaning they are constantly moving, and microcephaly or small head size, which becomes evident with time as the head circumference is normal at birth. Patients may also have a happy demeanor where they smile and laugh a lot, an autistic behavior, including poor eye contact and lack of use of facial expressions to communicate, regression, where they lose previously learned skills, such as walking, and cerebellar atrophy, where the cerebellum either shrinks or does not grow. Facial features can include an open mouth and uncontrolled drooling, and an elongated, narrow face with a prominent nose, jaw, and ears. This neurological disease is caused by mutations in the SLC9A6 gene on the X chromosome that encodes for the endosomal sodium proton exchanger 6 or NHE6. NHE6 is mainly found in early and recycling endosomes in our cells and is important in controlling the pH of the endosomes. Early endosomes with a pH of about 6.2 contain cargo from the plasma membrane and have a choice of either recycling the cargo back to the plasma membrane in recycling endosomes with a pH of 6.5, or to send that cargo deeper inside the cell to lysosomes with a pH of 4 to destroy cargo. The movement of the cargo depends on the pH of endosomes, which depends upon the amount of protons in the endosome. A VATPase pumps cargo inside the endosome, and the NHE6 acts as a leak pathway to allow protons to escape, thus alkalinizing the endosome and sending the cargo to recycling endosomes to be recycled to the plasma membrane. However, in Christianson syndrome, NHE6 is non-functional, which prevents protons from leaking out, causing an over-acidification of endosomes, which mistraffics the cargo for destruction to the lysosome, leading to a lot of problems. Unfortunately, no treatment is available to cure this disease. However, some of the symptoms can be targeted to various degrees. Indeed, anti-epileptic medications can be given to help reduce the number and severity of seizures. Valproate, the mechanism of which is not well understood, but which is thought to increase GABA levels and block sodium, potassium, and calcium voltage-gated channels, is usually the first anti-epileptic drug administered, to which clobazam, a benzodiazepine, is added if the seizures do not improve, followed by topiramate, lamotrigine, levetiracetam, and carbamazepine, other anticonvulsant drugs. However, they do not always work, and some children develop drug-resistant epilepsy, which is the most serious complication. Since a lot of boys die before age 10 due to SUDEP or sudden unexplained death in epilepsy, research to better understand the causes of epilepsy in order to find better cures is underway. For ataxia, unfortunately, there are no drugs. Since many kids have autistic behavior, psychosocial interventions can be used to help, such as social training skills to better understand social interactions and how to engage with others socially, cognitive behavior therapy that teaches children ways of thinking and behaving that help them cope with, face, and reduce their anxieties, and any activities that will help these children express their needs. Additionally, since this is a genetic disorder, gene therapy might be considered. In fact, the mutated gene may be replaced by a functional one in the hopes of resolving the condition, since functional NHE6 would be produced. However, gene therapy is a novel therapeutic technology, making it risky and very expensive. For now, research is ongoing to try to find better treatments for Christianson syndrome patients. In 2011, the Christianson Syndrome Association, or CSA, was created by a parent of a Christianson syndrome patient. They are actively collecting donations to further fund this research and help Christianson syndrome patients. So if you're feeling generous, we encourage you to donate to be part of the big family that wants to help these children.